Hello, my name is Thomas. This is my week 6 video. I've completed 150 questions on Kaplan and my 30 questions on UWorld, and I have reviewed all my missed questions. My top 3 questions are, and the first question I'll be talking about is, the nurse provides care for clients on an oncology floor. Which client does the nurse assess first after receiving report? The answer choices are: client diagnosed with breast cancer with extensive bone metastasis, who is irritable and confused; a client who reports nausea and vomiting 6 hours after chemo; client diagnosed with lung cancer who reports fatigue, mild shortness of breath with ambulation; or client with white blood counts of 1600 who reports burning with urination. So I chose the last one, client with white blood count of 1600 with the burning sensation of urination, because I thought since they are on chemo and they have such a low blood count, they're immunosuppressed, therefore we should be worried about any type of infections. So that's how I read it, but the correct answer was A, which is a client diagnosed with breast cancer with excessive bone metastasis, because that patient was showing signs of hypocalcemia, which could occur because of the bone destruction due to the tumor releases calcium into the bloodstream, causing the elevation levels and affecting mental status, and can respectively be negative, cause negative effects on multiple organ systems. The next question is a case study question. The case study is a 54-year-old client who is brought to the emergency department after being rescued from a burning building. Client appears nervous. Client is alert, oriented to person, place, time, and situation. Is moaning and rates pain as 10 out of 10 on a scale of 0 to 10. Has deep partial to full thickness burns are present on the client's face, neck, chest, abdomen, genitals, and all 4 extremities. Vital signs are respiratory rate of 28, SpO2 of 96% on non-rebreather. Client is coughing. Bilateral breath sounds are clear. And then vital signs is 100.5 fever, pulse of 120, blood pressure of 86/56. S1 and S2 are auscultated. All pulses are palpable. 2 large bore IVs are in place. And then the question is, the client is at the highest risk of developing hypovolemic shock, respiratory depression or infection, or sepsis, and the nurse should immediately administer IV fluids, prepare to intubate, or prepare to administer antibiotics. So I believe the patient was more at risk for hypovolemic shock due to the burns and the distribution of fluids. Therefore, we should have administered IV fluids. But the correct answer was that the client was at higher risk of developing respiratory failure. Therefore, we should immediately prepare for intubation. And then after inhaling injuries occur, client are most often rapidly developing life-threatening pulmonary edema that impairs oxygen exchange, and laryngeal edema that can completely and irreversibly obstruct the airway, therefore resulting in respiratory failure. And then my last question is, a 42-year-old client was admitted from a homeless shelter with a diagnosis of tuberculosis and alcohol use disorder. It is essential that which healthcare team member attends the care conference to discuss discharge planning and community. So I can't see all the answer choices, but I chose the infection control nurse specifically because he had tuberculosis, and therefore it didn't say what type, if he's showing signs or not. So I would expect him to have infection control, to talk to him to prevent the spread of TB in the community. But the correct answer was a social worker. It is the most essential team member to be involved. In discharge planning to meet with the client's needs and offer suggestions and the best community resource. The infection control nurse should follow up with the teacher about preventing the spread of the disease. I'm still confused, but that's the correct answer. Anyways, thank you.